Hi and welcome. This is Mark Struthers, and today we're going to talk about MRI and patient safety. When we substitute the X-ray for a radio frequency wave, then we don't have any problems with ionizing radiation, right? That's true, but now we have to worry if our patient is at risk using magnetic resonance imaging techniques and equipment. Greater technological expertise is required for utilization of MRI than for most other imaging modalities. And yes, there is patient risk involved with an examination, and we'll look at highlights of that in this presentation. With MRI, we are mapping the interaction of protons with radio frequency waves to create the image. MRI maps distribution and the environment of the hydrogen atom in the body. Hydrogen is the most abundant element in the universe. It is also the most abundant element in the human body. To make an MRI image, use is made of a static magnetic field, radio frequency waves, electromagnetic waves, and switched magnetic fields or gradients. If used correctly, there are no adverse effects found with the use of an MRI scanner. Of course, that is used correctly, but safety issues exist based upon the utilization of the modality and the patient. Each patient is unique and must be screened prior to an examination. The general public may think that MRI is generally used for head scans and knee studies. But MRI scanners can image a host of additional parts, including injuries of the joints, such as the shoulder, elbow, and wrist. It can also image the blood vessels, like the carotid arteries, renal arteries, peripheral leg arteries, and the breast, as well as abdominal and pelvic organs. So, what we're looking at is a whole body scanner that can not only image the anatomy, it can also create images in 2D, 3D, and 4D, which is 3D in motion. We also have hybrid CT scanners with MRI and positron emission tomography, which is nuclear medicine, with MRI. And the nuclear medicine, or PET, shows us the physiology of the body. MRI is phenomenal at showing detail and tissue. One of the greatest advantages of MRI is the ability to change the contrast of the images. Some small changes in the radio waves and the magnetic fields can completely change the contrast of the image. Compared to any other modality, the level of detail we can observe is extraordinary. The images acquired are deeper and broader than any other type of examination modality. With MR scanners and new techniques and interventional procedures, we're able to do functional MRI, which is the ability to see the thought processes in the brain and map the brain. We're able to do MRI spectroscopy, which we're looking at biochemistry, and molecular imaging. Now that we've looked at MRI and its functionality, let's take a look at how the modality works and how it impacts on the patient's body, and if, in fact, we can injure patients during examinations. The patient is placed into a giant magnet which aligns all of the protons, hydrogen protons in the body, to the north and the south. By using radio frequency signals, we can knock the aligned protons of hydrogen out of alignment, and then we can measure how long it takes them to go back into alignment or relax. This reflects the tissue density and type, and we're able to create data from there to make the images. The magnetic strength of the MRI modality is measured in Tesla. The greater the strength of the signal, or the more the Tesla, the shorter the time period to acquire the image and the better the quality of the data. The magnet is always on. So do you think there might be any potential hazards with the magnet being on? Something like the missile effect? Take a look at this image and you can see what the missile effect is. Metal objects are attracted by the magnet and they're drawn in with rapid force. You'd hate to be in the magnet when someone walked in who had a scalpel, say, in their pocket, and all of a sudden it was projected towards you. So in addition to knowing about the magnet and the patients and safety, we also need to understand what type of equipment we can bring in to the magnetic field of the magnet that would be safe to utilize. By bringing safety to the forefront and providing continual education, MR safety becomes a team effort. Everyone from the physicians to the environmental service staff is responsible for being MRI safe. Before entering the MR suite and during the MR procedure, you should make sure that you have nothing that can interfere with the magnet or be drawn into the magnet. Prior to getting an MRI, all patients are screened to see if there is any contraindications to the exam. In addition to having the patient being pre-screened prior to an exam, the American College of Radiology has defined 4 safety zones within the MRI facility that are numbered 1 through 4. The zones correspond to the increasing exposure to the magnetic field and therefore the increasing potential safety risks. Yes, there are safety risks, but most people think that they only have a risk of being claustrophobic. It's said 1 out of 4 human beings has claustrophobic tendencies, or the loud noise in an MRI, the knocking noise, can be up to 120 decibels more, which is the equivalent to a jet engine or a rock concert, so the noise can damage the delicate structures of the inner ear. There are a lot more risks involved with MRI than noise and claustrophobia, and we'll take a look at some of those, but it's relatively safe because the patient has been pre-screened. We have specific zones that we can let people enter into for safety, and the machine operators or medical technologists that are operating the machines or physicians are highly trained. Let's take a look at this image and see if we can figure out why we have safe and unsafe MRI equipment. Remember, equipment used in MRI environment must be checked by a biomed department and labeled MR safe prior to implementation. Well, we looked at equipment, and I bet you figured out any kind of metal equipment that goes near a giant magnet needs to have some sort of safety precautions taken prior to it, and we'll look at that a little bit later. But how about the patient? Well, the patient has to be prepared to go in the room as well. Adequate patient preparation includes the following. We need to make the patient obviously as comfortable as possible when they enter the room. And we can do this by explaining the procedure in detail to the patient, screening the patient for any contraindications for the MRI exam, and providing the patient with compatible MRI clothing so that they will be safe during the examination. How about MRI in pregnancy? Well, no permanent or deleterious effects on a fetus has been documented in the field strengths currently used in MR imaging, but most places do not do these procedures on pregnant patients. Although the exams are relatively safe, we have to worry about the static field effects, RF field effects such as RF frequency burns, gradient field effects, and the effects of contrast agents. The contrast media we use for MRI is gadolinium. Again, we might have adverse contrast reactions, and we do know that the gadolinium passes across the placenta to the fetus. We have no idea about breastfeeding, but we don't want to take any kind of risks for the pregnant patient and the fetus in having an adverse reaction to the gadolinium. What happens if there's an emergency in the MRI room? Say the person does have a reaction or they have a heart attack or something like this. What can we do? First, we would assess the condition and call code blue if it was warranted. Remember, the MRI room always has the magnet on, so we would need to remove the patient from the MR scan room and secure the scan room door so that when other emergency personnel come in, we don't have a problem with the field strength of the magnet and the type of equipment that they're bringing in. You can begin emergency care in the MRI control area, and it is the responsibility of the MRI staff to guard and monitor that door to the scan room after the arrival of emergency personnel to make sure that it does not get opened. The intense static magnetic field is always present even when the scanner is not imaging and may be up to 100,000 times the magnetic strength of the Earth. All medical interventions must be done in the MRI control area and not in the scan room. The risk of mechanical injury to the patient depends on the intensity, duration, and frequency of the exam, as well as the patient's anatomy and physiology. A mechanical injury can be avoided by using proper equipment settings, positioning, and safety measures. When we talk about mechanical injury, what we're referring to is the vibrations caused within the body. Just like the vibrations are caused within an ultrasound examination, there are vibrations within the body as the radio frequencies are emitted and absorbed. Mechanical injury can occur when these forces or vibrations cause tissue damage, bleeding, or pain in the patient. We use radio frequency pulses to create MRI images. The radio frequency field may induce currents in wires that are adjacent or on the patient, causing skin burn. Radio frequency waves, just like X-rays and microwave, are part of the electromagnetic spectrum, and we can make magnetism out of electricity and electricity out of magnetism. The radio frequency waves may also induce currents in the intracardiac leads, resulting in inadvertent cardiac pacing. Prolonged imaging may cause the patient's body core temperature to rise as well. In practice, significant patient heating is only encountered in infants. All MRI systems have mechanisms in place to monitor and restrict the specific absorption rate to levels of RF energy deemed safe by the FDA. The absorption rate is based on body habitus, and obviously as people are larger than infants, it is only the infants that we really have to worry about. In the screening process, we look for any type of implants or unacceptable device that the patient has on their body that can cause a problem. At first, we only worried about MRI exams of the head because patients used to have metal clips put in, ferromagnetic aneurysm clip. The attraction between the ferromagnetic aneurysm clip and the magnet can cause, in some places, damage to the patient as we are moving the patient through the magnetic field. With the advances in science, we've had all kinds of different implants and devices that go into the body now. So there is a complete listing of different types of manufacturers and implant devices that needs to be screened for before the patient has the exam done. These devices can range from an implanted defibrillator or pacemaker, clips used on a brain aneurysm, a cochlear ear implant, or metal coils inside blood vessels. There are a number of objects that people have implanted today that we need to screen for. Aneurysm clips from ferromagnetic materials are contraindicated for the procedure. Today, we usually find that we get a titanium alloy clip, and this has been tested and safe for up to 1.5 Tesla and lower MRI systems. This can heat up some when you're in a 3 Tesla and above system. In the higher energy systems, up to 10 Tesla, but talk about 3 to 7 on the average, you have to worry about implants, even something like a hip implant, because that metal can get heated inside the patient's body. What if your patient comes in with a cervical fixation halo? Well, most halo cervical fixation devices are considered MR safe at 1.5 Tesla and below. Even though you believe it's safe, you better check it out, because a lot of times what will happen is they'll put the Allen wrench, which is metal, and tape it on the device for adjustments. You need to make sure that that's not there prior to sending that patient into the MRI scanner. Today we have deep brain scanner implants, we have implants for nerve blocks, and what we're looking at here is this may lead to serious injury to the patient including the possibility of paralysis, coma, or even death. Deep brain stimulators are relatively contraindicated for MRI. The greatest concern for electronically activated or electrically conductive implants in the brain or other parts of the body is the excessive MR imaging-related heating, which can cause irreversible tissue damage. As we alluded to earlier on the pregnancy, gadolinium is the contrast media that is used for MRI. Contrast media can cause allergic reactions, kidney damage, or other complications in some patients. The most common reported adverse events are injection site pain, headache, and nausea, but you can have a severe reaction that is potentially life-threatening. Next, we'll look at the cryogen risk, which was be from a quench that wasn't planned. A quench is when the liquid helium in the magnet turns into a gas and may escape into the scan room, displacing the oxygen in the room and leading to asphyxia for anyone in the room. If a quench occurs, you need to get the patient out of the room immediately so that they can get some air. This is a broad presentation on MRI safety and was actually put together so that we could get people to actually use continuing education and study MRI safety to reduce the risk for themselves and their patients. Thanks for watching MRI Safety. If you have other interests in medical imaging, please go to my website, Mark Struthers, on YouTube.